All right, how you doing, guys? So my name is Glenn Bedell, and I got hip labrum tear for my assignment this week. So right now, what I'm gonna do is I'm gonna go over three basic exercises that are used in most rehab facilities when rehabbing a patient that has experienced a hip labrum tear and is recovering from hip labrum surgery, or maybe just trying to avoid surgery. But the three major things that they will always focus on is hip flexion, hip abduction, and hip external rotation. So these are three very basic exercises that are done without weights or machines, which, as the patients progress, they move into stage 2, stage 3, and stage 4. They would implement those machines. Obviously, I don't have those machines, so that's why I'm showing you the basic ones and what they entail. So the first thing that we're going to focus on here is hip flexion. And the way they do that is they have the patient lay on their back. And what you do is you're going to slowly lift one leg up and take your knee and pull it into your chest. And then come out and back down, up again, into your chest, and back down. And you would do that for about 10 to 20 times on each leg. And then, we would switch each leg because we want to focus on building strength evenly. It's very important in re-injury prevention. The next exercise that I'm going to show you, excuse me, I'm just getting over getting sick and I don't have a voice. The next exercise I'm going to show you is hip abduction. And again, we're going to lay on our backs and we're going to work on taking our leg and rotating it out, sideways, back in, and again you do that for the same amount of reps, 10 to 20 times, and then obviously we lift the other leg and switch, and we hit that same leg for the same amount of reps, trying to keep our leg nice and level, not letting it go up and down, but just moving it straight out. And you should feel it in the sides of your hips right there. And again, if any patient ever is experiencing any pain in this, obviously you would stop. But now we're going to move to the last exercise that I'm going to show you, which has to do with the hip external rotation. Obviously the hip is a ball and socket joint, and focusing on flexion, abduction, and external rotation are three very important movements that we need to have our range of motion in. So the last one, hip external rotation, it's kind of a combination of both exercises, really, if you think about it. We're going to lay on our back once again, and the first movement is to take our leg and put it up, and then we're going to take our knee right here, and we're going to rotate it out sideways, okay, until we feel a stretch, and then we're going to bring it back up, and rotate it back out sideways, and then bring it back up. Also done for 10 to 20 reps, and then you would switch legs. Now, all these exercises can also be done as these patients progress by adding ankle weights around the ankles or even around the knees for that particular exercise. Okay, I know that personally, I when I was rehabbing my knee, ankle weights were used for the strengthening of the lower body, and I know that for this particular, these three particular exercises, ankle weights can also be implemented as the patient regains their strength and progresses. All right, thanks a lot, guys. I hope you enjoyed my presentation, and good luck to all of you for the rest of the semester. Take care.